Hi, this is Denny Flint. What you're about to see is an unrehearsed, unedited, spontaneous conversation between our Chief Executive Officer, Steve Arter, and myself. When I say spontaneous, we're wearing jeans and you're going to hear a phone ring. But it's a conversation that we felt would give you an informal look at what we've learned on the road and the best way to kickstart the ICD-10 conversation. We hope you enjoy it. Hi, my name is Denny Flint, President of Blue Practice Resources. With me today, I have the pleasure of having Steve Arter, CEO. We've been out on the road a lot, Steve, over the last couple of years, haven't we?
Oh, yeah. A lot of road trips.
We've got the toolkit. You're going to read some great background and foundation for ICD-10. But our purpose today is really kind of share what we've learned and what we think it's important for you to know to be able to kickstart the ICD-10 conversation. How's that sound?
Sounds good to me.
All right. Well, our company has been all ICD-10 all the time. We've conducted over 50 assessments, dozens of on-site workshops, and we've learned a lot about ICD-10. For example, there's a lot of misinformation out there. Steve, at my workshops, and I know you hear this too, I hear this ICD-10's an IT. It's just an IT issue.
Oh, no, it's a coding issue.
Or it's it's not going to happen.
Right. Won't happen.
What do you think about it? You think ICD-10 is going to happen?
Yeah, ICD-10 is going to happen. There's no doubt about it.
Why do you say that?
Well, there's two fundamental reasons I tell you ICD-10 is going to happen. Number one, CMS is committed to it. They have burned the boats. Now, let me give you a little story history. I'm going to try and be quick here. Okay, in 1066, William the Conqueror came over from France to retake the throne of England, and he had quite an unruly group of mercenaries working with him. He brought them all over, and he was paying them, and they were all there, but they really didn't have a commitment to winning. So when William the Conqueror landed in England, he burned all of the landing boats. And as a result of that, all of these guys realized, hey, it's either win or die. That's it. There's no going back. And that's what CMS did when they terminated the use of ICD-9 and the expansion of ICD-9 in 2011. Over. Done.
We're not even supporting ICD-9 anymore. No more updates.
No.
It's 2 years gone and unrecoverable.
The other thing that tells me it's going to happen is that at the most recent work group on electronic data interchange meeting in Washington, D.C., and that's the organization that runs this, okay, what they did was they announced that all the payers were ready for ICD-10. The payers are ready for ICD-10. Okay, and if the payers are ready and CMS is committed to it and they've burned the boats and large hospital systems around the country are preparing for it and have spent millions, it's going down. It's going to happen.
And this thing's been going on since 1996, way back with HIPAA.
Right.
HIPAA started setting these rules for standardizing code sets, and we have a legislative mandate to do it. So,
it's the law.
Is it fair to say it would literally take an act of Congress to derail ICD-10?
Absolutely. That's what it would take. It would take an act of Congress to derail ICD-10. So don't be confused or don't use that it's going to be delayed as an excuse not to move forward. And you bought this toolkit, so you're moving forward, and I commend you for it.
Yeah, we hear a lot about ICD-11. ICD-11 is going to be released by the World Health Organization. They're saying in 2 years. It's 2015 from the date of this video. So, there's a lot of kind of requests and pleas out there. Well, let's just skip ICD-10 and go directly to ICD-11. Why do you think
it's not going to happen? And it won't happen because the clinical modifications for ICD-11 won't be ready till at least 2020.
Yeah.
And we're not going to wait from 2011 to 2020 to add any new codes to our system. We can't afford to. It doesn't serve patients, doesn't serve physicians, doesn't serve care providers, hospitals, agencies that are trying to take care of patients. It doesn't work, and it won't happen.
Yeah, I agree. And the acting administrator for the Department of Health and Human Services Center for Medicare and Medicaid Studies, if you have any doubt that they're not committed or that they have burned the boats, take a look at the language of this letter. What were some of the words she used? Foundational and
cornerstone. It's the cornerstone of a much greater change that's going to take us to an e-health system in this country. We are not going back to paper.
Nope.
So if you've got any question about delays or whether ICD-10 is going to happen, do not bet on it. Do not go to Las Vegas and take whatever odds they give you.
Yep, they burn the boat. So what does ICD-10 look like? We always get the question, well, what is this thing and why do we have to have it?
Very simply, ICD-10 is an increase to the specificity of the diagnosis codes. Okay? They went from 5 digits to 7 alphanumeric characters so that we can explain much more clearly what's wrong with the patient, exactly what we're treating the patient for and why.
So that's a benefit to healthcare, I would think.
Huge benefit to healthcare, and in my estimation, this is the biggest, best change that could ever happen to healthcare providers. I've been doing this 25 years, and let me take a minute here and speak to physicians, from my heart. Physicians have saved my life twice. Once when I was about 9 years old, and again just a few years ago. And I have a real soft spot and appreciation for what you do, doctors. So doctors who are listening to this, please understand what I'm about to tell you. I'm telling you as a friend and a man who's committed 25 plus years of his life to helping you with your businesses. You must document. Specificity requires better documentation. Okay? Let me give you an example. A fracture of a patella under ICD-9 has 2 codes. Okay? An open fracture and a closed fracture. You had no incentive under ICD-9 to document. Okay? Because it didn't matter how much more you put on the piece of paper. ICD-9, if you put fractured patella closed, you were done, and you had a code. Okay? Under ICD-10, the insurance companies have made it very, very clear. They won't pay any unless you use a specific code, and under ICD-10, there are 480 codes for a fractured patella. 480. Now, before you all gasp and decide that October 1st, 2014 is your retirement date, I don't want you to focus on that. This is what's been used to scare the life out of you and to drive you underground. What I'm telling you is 4 additional elements of documentation. Change that to a very specific single ICD-10 code that says that is a closed fracture, the right patella, it's a transverse, non-displaced fracture, it's an initial visit with a normal degree of healing, and there's only one code for that. You will know exactly what was wrong with your patient. You'll be able to code it, you'll be able to report it, and you'll be able to analyze the acuity levels of your patient's databases. All right? Please document to the ultimate specificity. We're not talking about 70,000 codes here. We're talking about 30, 40, maybe 50 elements of documentation in your specialty that you must learn over the next year. This is doable.
Well, let's talk about specificity for a second. I mean, we've worked with hundreds of practices through the years, and, we see in ICD-9 denials for lack of medical necessity. In other words, you don't have a diagnosis acuity level that clinically justifies the procedure or service we're rendering. That's all going to be fixed with ICD-10, right?
That's correct. ICD-10 is medical necessity. ICD-10 establishes medical necessity, and for the rest of you who want to champion your physicians to go out there and do this documentation, what that means to you is it means fewer requests for additional information. It means fewer denials. Okay? It means fewer calls from those ancillary providers such as imaging centers and labs asking for a better diagnosis. But these are part of the processes that you'll have to change.
And this is a good thing for patient care too, right?
Huge for patient care.
I heard that example about metal prosthetics that you gave that one time.
Yeah, that's right. For years, we were doing replacement prostheses, hip replacements, on patients every couple of years. And when ICD-10 came in Britain, the data analysts in Britain realized because of the specificity of ICD-10, they were doing the same thing. But it was because the metal prostheses were the ones breaking down. Okay? And they simply communicated to us, hey, don't use those metal prostheses anymore. You have to replace them every 2 years.
And we had the data to do that.
And we had the data. That was a benefit. We couldn't report worldwide on SARS, swine flu, any of those pandemics that were coming down. We couldn't report on them with the rest of the world because they're all using ICD-10 and we're not.
So it's a good thing for patient care, but it's also a good thing for patient financially, right? Because what happens when that imaging group doesn't receive a specific code for an order for an MRI or CAT scan?
They can't get paid, and the bill falls back to the patient.
So we're actually becoming patient advocates with ICD-10.
There are tremendous benefits across the entire scope of your practice to ICD-10, and nobody talks about those. Nobody talks about those, but I tell you, it's like Denny said. we've done assessments in over 50 practices right now. We've gotten our fingers dirty. We know what it's going to take and what it's going to do and what the outcomes are going to be. And the outcomes are beneficial. And I don't want to sit here and tell you that there's not going to be a short-term negative impact from this change. There's always slowdowns in productivity and things like that. But in the long term, once you make the change, the benefits will be tremendous for you as providers of care.
But at the end of the day, it's the providers. You've made this great initial investment with this toolkit, and we promise it's really going to help you. It's going to give you a systematic, methodical way to marshal all these moving parts. But at the end of the day, what's the first thing you should do when you stop this video? Have your physicians watch it. You could have the best implementation team, the most thorough impact analysis, the most articulate project charter, but at the end of the day, it's all about documentation.
That's correct. Denny, I just want to say one more thing, and then we're going to wrap it up. Some of you out there have planned weddings. Okay? Think about it. Did you just show up on the day of the wedding? No, you didn't. There was a lot of things that had to go into it. I have a good friend, and I was telling him about ICD-10. It's the first time he was hearing about it. And his thoughtful response to me after listening to me for a while was, how do you eat an elephant? And I said, I don't know. How do you eat an elephant? I have no idea how you eat an elephant. He says, one bite at a time. And that's an illustration of what ICD-10 is. There are a lot of moving parts. You have to plan for it, just like you plan for your wedding. And you couldn't have a better tool to help you do it than this toolkit. It'll take you there one bite at a time. Whether you're front office, whether you're billing, coding, physician, IT, there's a section there for all of you, and it takes you step by step through what to do. So please, because I'm sure I'm going to end up in the hospital again sometime before I die, I want there to be a doctor there. Please take this to heart. Operate as a team. Put your plan in place. You'll be glad you did. Thank you. Thanks, Denny.
Thank you.